This is anterior. You can see your pulmonary trunk in the front and the aorta behind it. You can see your right atrium, left ventricle, right ventricle. Okay. You can see your superior vena cava and your down here, your inferior vena cava. If you turn it around, you can still see your inferior vena cava, superior vena cava, and the aorta right here. Okay. So let's do the inside first. We'll do the coronary vessels last. We'll close it back up and do all of them. So you can open it up. And there's not that much you actually have to know inside the heart. Again, right atrium, right ventricle, left atrium, left ventricle. Here's your tricuspid valve or your right AV valve right here with the chordae tendineae attaching to the papillary muscles. On this side you can see your bicuspid valve. Again, chordae tendineae, papillary muscle. Okay. The right ventricle pumps up into the pulmonary trunk. So this right here is your pulmonary semilunar valve, right here. Okay, and then the left ventricle here comes into the aorta. So you have to look up in there, and you can see the aortic valve. Can you see it?
That white.
Yeah, it looks like the semilunar valve over here, but it's in the from the left ventricle, and it's going up into the aorta. Okay, so sort of behind. You guys see it? It should be up there. You can't see it, but it's right there. So you can see it. Okay. This is the interventricular septum. That's just the myocardium, the heart wall that separates one ventricle from the other. And I think that's it. I don't think you guys even have to know sinoatrial node or anything.
I have a quick question.
Okay. Wait. Coronary arteries and veins. Next. And then we'd be done. Okay. So front of the heart, again, we'll do the back after. Okay, here's your aorta. So your aorta has oxygen-rich blood. It's coming from the left ventricle. It's going up through the aortic valve and into the aorta and out to the tissues in your body. And some of it goes back to serve the outside, the wall of the heart itself. Okay, the heart tissue. So you can see your right coronary artery branching off right here. It comes down, 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 down. And this branch right here, along this bottom, the heart kind of sits like this. So along this bottom margin of the heart, this red branch, right here, it's got a little number on it. That would be your marginal artery or your marginal branch. Sometimes they call it the marginal branch because it's a branch of the right coronary artery. And right next to it, the blue one next to it is the vein. That's your small cardiac vein. Okay, so they hang out together. Okay, on this side you can't see, but so here's your, here was your right coronary artery. There's another one just like that on the left. That's your left coronary artery. It goes behind this pulmonary trunk. So you can't see it, but it travels behind here, and you can see right here is the very end of it. This is the end of your left coronary artery.
Before it branches.
Right here, your left coronary artery ends. Right here. So all you can see on here is this tiny little end bit of it. And then we either go into the anterior interventricular artery. Anterior, it's on the anterior side. Interventricular, it's between the ventricles. Or if it wraps around this way under the left atrium, that is your circumflex artery or the circumflex branch. Okay, so the left coronary artery is just this right there. With your anterior interventricular artery is your great cardiac vein in blue. Okay, so they're friends. They're in the same spot together. And if you follow your circumflex around, we can come to the back of the heart. Posterior view. So, see this one right here, this red artery? This is your posterior interventricular artery. So again, between the ventricles, but now we're on the posterior side. The vein that goes along with it is your middle cardiac vein in blue. Yep.
So we have a greater,
the middle cardiac vein, along with many of the other veins that are draining the myocardium, empty into this big fat coronary sinus right here. And the coronary sinus, along with your inferior and superior vena cava, empties into your right atrium. Done. 6.
Can you start over?
No.